Let me just, oh, sorry, apparently I didn't open the poll. So the poll is open right now, and please vote, and I'll close it in about 10 minutes so that we know what our topic will be for next month. So voting is open now. In the meantime, as you vote, let me get to your questions. Oh, one more thing. We have a new promo code. If you're thinking about joining, this promo code is better than the one that we had before. So you can get $100 discount for your first month in the program. So that's something to consider. Okay, let's get to the questions. So, how do we address pulling when it happens unconsciously versus when it happens consciously? There are roughly two strategies that I can advise here. One is that you can first learn where is it that you, or in under what circumstances you tend to pull unconsciously, and then learn to predict it, and then use stimulus control techniques. Stimulus control techniques are all those techniques that either minimize the urge, make it go away completely, or techniques that prevent you from actually pulling. For example, one example that I really like, but not many clients like, it is efficient though, which is wearing gloves. That's an example of stimulus control. If you're triggered, let's say, by coarse hairs, if you wear gloves or finger covers, you won't be able to feel their texture. So technically, even if you touch your hair unconsciously, you won't feel the urge to pull, and you won't be able to identify which hairs to pull. So that would be one way. The second way would be to work on becoming more aware of unconscious pulling, so turning it into conscious pulling, if you will. You can do that by self-monitoring. You have our free app that you can download and use independently of our program. So that's definitely something to consider. And most frequently, what we do in our program in TrickStop is that we combine these two approaches. So we use stimulus control, but then once you become aware of it, we also implement competing responses so that you cover it on two levels at the same time. How do I know what issues lie underneath pulling? I really like your onion analogy, but I don't exactly know how to apply it to myself. Yeah, that's a good question, and it's not an easy one to answer. As I said, I think for every person it will be a different thing. Roughly, we can say that if you pull, you very likely need to work on understanding your emotions, learning how to verbalize your emotions, learning how to be with your emotions instead of running away from them, since pulling tends to be a mechanism of avoidance. So that's something that I can say. I guess we can say stress, anxiety, these kind of typical things. But specifically what that means for you, I can't tell you because I'm not psychic, so I can't unfortunately give you a precise answer. That's something that you can, and that you do discover through therapy. Are you acquainted with NAC? I have been using NAC for 3 or 4 months at this point. I'm seeing very little changes, and even those changes that I see, I'm not quite sure if I can attribute to NAC. Can you recommend how long I should take it before I see any results? If you haven't seen any changes after 3 months, I don't know what dosage you've been taking, so it's hard for me to know. But yeah, you can Google. There are studies that you can Google, and you can find the exact dosage that they tested. So if you've been subdosing yourself, then there's no reason to expect any results with that. But even if you've been taking an appropriate dose of NAC, I don't think, if you haven't experienced any benefits after 3 months, I think it's safe to say that you won't. NAC roughly works for about half of the people that take it. So there's no guarantee that it will work. Are there any medications that I can take it really resonated what you wrote about being open and vulnerable, and I don't think I'm capable of it, but I will happily take any medication, smiley face. So officially, FDA has never approved anything for hair pulling. So officially, there's nothing that you can be prescribed. Frequently, antidepressants are prescribed off-label, and some other drugs have been tested, some shown to be mildly effective, some not. We had a webinar on this topic about a year ago, and we can repeat that also if you would like that. And as always, if you have any topics that you would like me to address in webinars, just type it in the Q&A, and I will put them in the poll for next month so that you can vote for them. Anyways, back to the medication. So yeah, certain things like antidepressants can be prescribed off-label. Overall, what we see from the studies that we have is that psychotherapy is more effective than medication. So it's not just because I'm a therapist that will recommend psychotherapy. It's also because it just seems to work better. So that's the story with medication. Let me see what's next. Is the urge for pulling a learned behavior, how we react to stress, anxiety, or is it something we just intentionally feel just to pull? Because sometimes I find myself trying to trigger the urge. I don't know that I understand the question completely. So you can say that nearly anything is learned behavior, because so much of our behavior is learned. So I can definitely say yes to that. How and why we learn specifically this is something that we can examine. The reasons are hidden in your biography if you care about learning them. And I don't know what it means intentionally feel just to pull. I'm not quite sure what that means, but if you mean that you pull because it feels good, then yes, pulling provides a kind of instant gratification, but that doesn't change the fact that it's a learned behavior, right? So sometimes, yeah. Anyway, let's just not because otherwise, if I go on tangents, we'll never end this. So let me just stop there. So if you find yourself, there's another question here about a person just feeling like they need to pull, not necessarily in response to stress or anxiety. So this also happens. Sometimes when people feel understimulated or completely unstimulated or bored, as people would say, then pulling comes as a way to provide some stimulation for yourself. So yes, that is common, and in that case, you don't necessarily have to deal with stress reduction or things like this. But what you do need to do is examine what boredom is like what that experience is. What's the emotional content of boredom? What do you feel in your body? What kinds of thoughts you have? Because that will tell you what is it that you're trying to run away from. Like what's the purpose of needing stimulation in that moment? And then maybe you can unravel a little bit more of the story behind why boredom triggers you. If you pull because you feel there is something physically there or physically wrong, how do you come to terms and stop in the moment? So stopping in the moment is more of a behavioral thing. So habit reversal training can give you practical techniques to stop. We use habit reversal in our program, and we've had 2 or 3 webinars even on habit reversal. There was one where I even explained how to use it as a self-help technique. So you can take a look at that. But if you feel like there's something physically wrong, the first thing that you should do always is actually check with a dermatologist. Maybe there is something physically wrong. And if the dermatologist says that there's nothing physically wrong, then there's this process of acceptance of what your hair is like and how your hair grows. It's a process that takes a little while. It's not something that I can give you like 1 to 3 in terms of steps to achieve. I'm sorry. I mean, maybe someone has the protocol for that, but it is something that happens through therapy. what we would usually do in therapy in this situation is examine how you actually came to the idea that you have about what your hair should be like. What how did you come to decide what's physically wrong and what isn't? And then we would examine what that means to you. And we would take it from there and then focus on changing the meaning, because that's usually where emotional trouble comes from what things mean to us, not what they actually look like. I've been going to psychotherapy and I have made some small progress, but I'm also replacing the hair pulling with other forms of compulsions. Can you give any tips to stop those other compulsions from developing? So can you, if you're still here, can you please just write a little bit about what kinds of compulsions are you replacing pulling with? This is important to find out. Uh, because I'm wondering whether you have trichotillomania as, as a form of body focused repetitive behavior, or perhaps a form of OCD where pulling is just one compulsion. Because OCD and hair pulling are not, one and the same. Hair pulling is similar to OCD, but it is a different condition. And then sometimes a person can have OCD that just manifests in this way, in which case the treatment will be slightly different. So that's one thing. Like, what's the specific type of compulsions? So if you're listening to this, you can type it there. I'm starting to scratch my scalp a lot. Oh, okay. So maybe you can, in this case, again, this is just from my experience. It doesn't mean that it's true for everyone, but a kind of an alarm just set off. It could be just that this is anxiety just breaking through in some other way. And if that's the case, then anxiety management is something that you should really deal with. So try to deal with anxiety in a systematic way. See what triggers it, how it manifests for you, what messages it has for you. Implement some kind of anxiety reduction routine, like exercising, eating healthier, avoiding caffeine and other stimulants, practicing mindfulness, progressive muscle relaxation. You have a gazillion things out there to reduce anxiety. So then that's what's best to work on. That's at least how I would approach it. So 100% of you voted in the poll. So I'm going to close the poll now and see what our topic will be for next month. So let me see. 45, 45. There are 3 topics that have the same percentage. So there's self-compassion, ritualistic behavior and hair pulling, and boredom as a trigger. Because boredom as a trigger is the first one, let's do boredom as a trigger. And then I will leave these 2 next month so that you can vote for them. So boredom will be what I actually just briefly mentioned about being overstimulated or understimulated. So that's what we'll be talking about. You talk about patience and discipline as if it's something that can be developed. I have ADHD and I believe that I cannot be disciplined because of my ADHD. Well, ADHD certainly will make it difficult for you to be disciplined or even patient, because one of the things that come with ADHD is problems with impulse control. But my point still remains, which is that those are the skills that you can develop. It might be more difficult for you and it might take a little more time, but it is still quite possible. So don't give up. And there's another question about ADHD here and ADHD medication. So let me read that one. When I started taking ADHD meds, my pulling has significantly worsened. Whereas in one of the support groups that I've attended, someone said that their pulling actually lessened to the point of almost stopping after trying ADHD medication. Why is this? Well, that's $1 million question. This pattern that you've identified is something that I've seen in my practice as well. But I tried to find research on the topic and I couldn't find any. When people take the same medication, you would expect it to have similar, if not identical, effects. but apparently when it comes to BFRBs, it doesn't. So I see that some of my clients experience a worsening. Sometimes ADHD medication even triggers the beginning of an episode of pulling or skin picking. But for others, it will make it less prominent. I, if I'm going to be perfectly honest, I think a part of the explanation might be lie in the fact that not everyone who is diagnosed with ADHD actually has ADHD. It's something that's wildly overdiagnosed. So it, that could be an explanation. I'm not saying that it is, it's just something that comes to my mind. Um, but I don't know. There simply aren't any studies. I've noticed this as well, and I always ask my clients when they say that they have ADHD to determine which one it is. When there's a worsening of symptoms, it's usually a worsening that comes in the evenings when the effects of Adderall wear off. Like that's when pulling usually escalates. That's something that I've noticed. So that gives us a certain, regardless of what causes it, it gives us a degree of predictability so that we can work with that in therapy. So in that sense, it's quite a useful thing, even if I don't know where it comes from, if I'm being honest. Let me see what else. I find that anxiety is a very big trigger for me, and my therapist suggested that I try mindfulness-based stress reduction. I just find it very difficult to meditate. I don't think I'm very good at it. Can you just kind of clarify what you mean by I'm not very good at it if you're still here? Because I don't know what that means. I mean, no one's good at meditation. I do it twice a day and have been for a long time, but I still wouldn't say that I'm good at it because you always get distracted if that's what you mean. Oh, here's the answer. My thoughts are wandering everywhere, usually about planning stuff and stuff I didn't do well, and it makes me feel anxious to the point of panicking. Okay, so this happens sometimes that because fundamentally what mindfulness does is it brings us into direct contact with our feelings. If you tend to dissociate or run away from your feelings, then in that case, you need to kind of slowly ease into mindfulness. So start with shorter exercises. Maybe instead of focusing on your body or your breath, you can try loving kindness meditations or self-compassion meditation or simply grounding exercises, some kind of informal mindfulness, something that will slowly teach you to tolerate your emotions. But it doesn't mean that you're bad at meditation. It just means that you need a different entry point. In fact, one of the best meditation teachers that we have in the West, Joseph Goldstein, he talks in one of his books about how when he started learning meditation, he had a very hard time sitting because he was very restless. And for years, he meditated walking instead of sitting. So he just needed to find a different entry point, and then he became a truly great teacher. So don't give up just yet. And meditation for sure is, I think, the best way, the best non-medical way at least, to reduce your anxiety levels. So by all means continue. Oh, here's another clarification. So in addition to anxiety, I also struggle with PTSD. Okay, so in that case, if that's the problem, then maybe find a meditation teacher. It's quite possible and even beneficial to use mindfulness for PTSD. You just need to apply it in a very specific way. It's something that I don't like. When someone has PTSD, I really approach introducing mindfulness carefully. There are a few books about the topic. If you're interested in that, I will send, just email me. You have my email here in the lower left part of the screen, and I will send you the books that might be helpful for you. So yeah, you can still learn how to meditate. You just need to approach that in a slow and careful way. You mentioned befriending the urge to pull. This sounds completely impossible to me. I find it unbearable to feel the urge. Uh, I understand that that's what it looks like, and learning how to tolerate unpleasant emotions is something that you do in therapy. So again, it's a skill. It's not something mysterious and mystical. Many people have learned it, so can you. It just takes some time. If you want, you can even try. You can buy a book. Stephen Hayes wrote a book, something about when you need a book title, you can never remember it. Something, I believe it's called Liberating the Mind or The Liberated Mind or something like this, which is essentially a digest of acceptance and commitment therapy. A large part of it deals precisely with this, how to relate to very difficult experiences. And you'll see very kind of down to earth ways in which you can practice this because it's a skill. Think about it like this, like some emotions we obviously know what they mean, like guilt or sadness. Sadness implies loss. It's not pleasant to feel, but we know that we have to allow ourselves to mourn when we lose something or someone. So we know how to translate sadness, and even if it doesn't feel very good, we can still have a productive relationship with it. Absolutely the same thing can be developed towards the urge, except that in that case, you might need to develop a more personalized interpretation of the urge in terms of what triggers it and what it means to you. But it's really, really quite a learnable skill. A part of me does not want to let go of the habit of hair pulling. Is there any explanation to it? Oh, yes, of course. So I mentioned previously with the onion thing that every symptom serves a purpose. So pulling also serves a purpose. Humans are not generators of random behaviors. Everything that we do stuck around for some reason. Like people, because when people talk about pulling from that aspect of it being a habit, they will usually kind of use the word habit to dismiss any meaning to it. And if you think about it, why on earth would you continue to do something unless it actually has a meaning? We brush our teeth not because it's a meaningless habit, but because it's a very important, meaningful habit that serves a very important purpose. Actually, several purposes, right? And the same goes for pulling. If pulling is your way to avoid certain difficult emotional experiences, then you need to find a different way to approach these so that you can let go of pulling. If pulling is your only way to feel some kind of instant gratification when you feel overwhelmed, then of course you're going to be reluctant to get rid of it. How wouldn't you know? Of course you would be. Anything else would be unimaginable because it does such an important thing for you. I will make a slightly inappropriate comparison now just to illustrate my point. When you think of people who either struggle with alcoholism or do drugs, one of the reasons why drugs or alcohol are so difficult to quit is because they serve an important purpose. A person who cannot tolerate their own emotions or struggle with feeling guilty because of certain things that they've done or whatever, for whatever reason that they start drinking, let's say, and then drinking makes all of that go away. It's like a magical pill. You feel guilty, you get drunk, you don't feel as guilty or you don't feel guilty at all. If that is absolutely the only way that you have to cope with an unpleasant emotion like guilt, of course you will have a hard time letting it go. Because implicitly, by letting go of that behavior, you're actually condemning yourself to suffering. So it's not enough to just replace pulling with something and then call it a day. You actually have to develop an alternative mechanism for the function or functions that pulling performs. So that's why a part of you doesn't want to let go. And you know what? On another level, I think it's perfectly okay. If right now you're not completely willing to let go of pulling, just think from a very obvious, like just take a step back and see if you have the willingness to at least cut back by 10%. If that's the best you can do right now, just be there. Small victories deserve to be celebrated as much as the big ones. Wars are not won with one battle usually. So in that sense, if you can only let go of a small part right now, then do that. Sometimes when my clients feel reluctant to let go of pulling, what I will suggest is that maybe they try to limit pulling in the beginning. So instead of trying to replace pulling with something else, or to just, force yourself with willpower not to pull, I will say maybe you can limit pulling to 10 minutes instead of 15 minutes. That's still pulling, but at the same time, it is getting a little bit of getting ahead of pulling, if you will. You're kind of gaining a little more control over it. So when you become readier to change, then you will already have this level of control over it. It's perfectly okay to not be ready to change. Change is not easy. There are people who cannot change things that seem much simpler than pulling because change is really hard. So don't be too harsh on yourself if you struggle to let go. Okay, there's another question. Let me just look at the time. Okay, let's take another question and then we can stop for this evening. I really feel like I want to stop pulling, but I have a lot of resistance. I'm currently in the program, and whenever my therapist suggests something, I tend to immediately impulsively say that I can't do it. I will provide long explanations as to why I can't do it, whereas in reality, I'm semi-aware that I'm just making excuses for myself. So this question, it says anonymous attendee, so I don't know if it's the same person like who asked the previous question, but resistance is quite a normal thing in therapy. I would share this with your therapist and see if you can discover what's the purpose of that resistance and what is it that you're trying to preserve. Sometimes it's because pulling does something important, and sometimes weirdly it's because pulling actually does something bad. Sometimes naturally when you pull for a very long periods of time, what happens is that it erodes your sense of self-worth or your self-esteem. And whereas logically speaking, on the surface, no one should want to have low self-esteem. Sometimes maintaining that is actually favorable. If you've been struggling with it for so long, giving up even on something bad that has been with you for so long is very much anxiety inducing, even when you're letting go of something bad. Because even if it's bad, if it's still known, and if it's known, then it's safe. So a symptom can actually feel safe. And then once you come to the point of replacing it with something new, that can be anxiety inducing, and then you can feel resistance. And another possibility is that you and your therapist are kind of entangled in a relationship where for some unconscious reasons you feel the need to resist. That's possible. And also it could be possible that your therapist is simply not suggesting things that are possible for you to use. So all of these are equally possible. Share what you feel with your therapist and work through it. These kinds of points in therapy are quite common, so don't worry about that. Okay, so there are a few questions that I didn't answer yet, and I won't have time to do that this evening. If you think of anything else, you can email me. And we have another webinar. It's a short webinar, which it's like a promotional webinar for the program for people who want to learn about how TrickStop works. Because usually I get too many questions, and then at some point I get really tired, my throat, you can hear my voice has changed. I've decided to open up the other webinar for a Q&A as well. So if you think of anything else that you would like to ask, you can join that other webinar. It's like 15 minutes long, and then we can have a longer Q&A session if we need to. So keep that in mind if you don't want to email me, if you want to get an answer like this. So that's it for me. Next month, we'll be talking about boredom as a trigger. So thank you everyone for being so patient, and thank you for your questions, and see you next month.